watching a Youth TV, empowering you.
Here again for another episode in which we talk about health and lifestyle. And today our area of interest or discussion is going to be birth preparedness plan or emergency preparedness plan for a pregnant mother. This is a plan that every woman who is pregnant must have, okay? And this plan has to be developed during pregnancy, during antenatal visits, and before labor starts. And this plan is developed between the mother and the health care provider who is taking care of this mother. And why do we have to have this birth preparedness or delivery preparedness or emergency preparedness plan? We know every pregnant mother is at risk of a complication. Okay, even when the pregnancy is normal, there is no complication. At any time, a complication may set in. Some of these complications are unpredictable. They occur suddenly, and when they occur, sometimes they are life-threatening. They can lead to a maternal death, or even the baby itself can die. So that is why we have to have a birth preparedness plan or a delivery preparedness plan. It is part of the safe motherhood. Safe motherhood is a set of interventions that we put in place to make sure that the pregnancy is safe, the mother and the baby keep healthy, and at the end of delivery and at the end of the pregnancy, we have a healthy mother, we have a healthy baby as our ultimate outcome. Therefore, birth preparedness is a very big aspect of safe motherhood and a very big aspect of delivery preparedness. So what is under this preparedness plan? There are a number of items that a mother has to be aware of and has to prepare for her to be ready to go through pregnancy safely and through delivery safely. And what are these? One, every mother or every pregnant woman must be knowing her expected date of delivery. We usually call this an EDD. So EDD is the expected date of delivery, or the date when she's supposed to give birth. And this is usually calculated from her last normal menstrual period. And this calculation usually gives us the expected date of delivery. By the end of pregnancy, a pregnancy usually is about 40 weeks. But we know after 37 weeks, most babies are mature and can be delivered at any time after 37 weeks. If a baby is delivered before 37 completed weeks, we call that a premature birth, a premature delivery. And that is associated with a lot of complications. We know prematures are difficult babies to take care of, and they usually face a lot of complications. Therefore, a mother must be able to know when her expected date of delivery is, so that she's able to plan and labor does not start before she has planned. And in case labor starts before that expected date, then she knows that this is either a premature labor or another complication. Another way of getting this expected date of delivery is through doing an ultrasound scan. We usually prefer an early ultrasound scan in the late first trimester or early second trimester. That is between 8 weeks and 14 weeks of gestation. At that time, a scan can give you an expected date of delivery with a high degree of accuracy. Even after that, we can have an estimate, but the error range of the scan will be higher. Therefore, by the early second trimester, every mother should have done her first ultrasound scan, and this scan can give you an accurate estimation of the expected date of delivery. And this is very, very important for planning purposes. Apart from knowing her EDD, she also is supposed to know signs of labor. every pregnant woman should know signs of labor, and this is more so with the first-time mothers, the ones we call prime gravidas, who have never gone through labor, who don't know what labor is. There are three major signs or symptoms of labor. One is abdominal pain. This pain is usually special. It is different from the regular pains that women get. This pain is usually colicky or crampy in nature. That is one. Number two, it comes at intervals. It is rhythmical. And number three, it keeps increasing in frequency and intensity. So if a mother tells you, I'm getting crampy abdominal pain that keeps going and coming, and each time it comes, it keeps increasing in the intensity or severity, then that is labor pain. Another sign of labor is vaginal bleeding. If she tells you, I've seen some spot of blood, then it could be a sign of labor, although bleeding before the baby is mature is abnormal, as we shall see later on. If she sees a thick vaginal fluid discharge, a mucoid plug, we call it show. Sometimes it comes when it is whitish, sometimes it comes when it has blood stains. If she tells you, I've seen a vaginal thick mucoid discharge with blood stains, it could be an early sign of labor. Then other signs of labor could be drainage of fluid, which we call liqua. You know, a baby is usually surrounded by a sac of fluid. Sometimes that sac of fluid breaks. It usually breaks when labor is advanced, and that is okay. When it breaks so early, we call it premature rupture of membranes. And if it ruptures before the baby is mature, that is premature rupture of membranes, which is not good. But during advanced stages of labor, we usually see this sac breaking, and the woman comes to you with a drainage of fluid that is clear, and it soaks her pants and drains down the legs. So if you have labor pains, you have discharges, you have bleeding, you have drainage of fluid, those could be signs that you are actually starting labor, and therefore you need to run to the place where you can be taken care of. So that is the other aspect that a pregnant woman should be aware of. Should be able to know her expected auto delivery, should also be able to know the signs of labor, so that when they come, she's able to tell. Again, a pregnant woman should be knowing her expected place of delivery or her preferred place of delivery. By the time she reaches 9 months, she should be aware that I'm going to deliver in a certain place, and she should know this health unit by capacity. Is it a health center is it a district hospital? Is it a referral hospital? Is it a hospital with advanced support, or it is a basic healthcare unit? What is the staffing level? What is the capacity? Are they able to do a cesarean section in case it's needed, or they can only do a normal delivery? So she needs to know, does this healthcare center have specialists? It has only midwives or medical officers. So she has to know her preferred place of delivery by even capacity. In fact, we tell these women to go and visit their expected place of delivery or preferred place of delivery before time, so that they are able to establish all this. So that is another aspect that is part of birth preparedness. Then she should be aware of the skilled birth attendants. That is the healthcare worker that is going to take care of her during delivery. And there is a number of these. We can have midwives, we can have medical officers, we can have obstetricians, gynecologists. So she has to be aware of who is going to deliver me, who is going to take care of my labor. And she should even have a contact, a telephone contact of such health worker, so that she's constantly in touch. And in case labor starts, she's able to communicate with this healthcare worker. She should also prepare for a caretaker. Usually this is the caretaker that is going to stay with her in the hospital or in the health unit where she's going to deliver from. She also needs a caretaker that will stay at home to take care of other children and other cares at home. So she needs 2 caretakers. So by the time the mother is at 40 weeks or 9 months, she should have communicated to all these caretakers, and she knows so and so is going to take care of me when I'm in the hospital, and so is going to stay at home and take care of my children and other activities at home. She should even have their contacts. Another aspect of preparedness is spouse or partner involvement. She has to know if the husband is going to be available. If they are not available, is there any other next of kin that is going to be around to give that support that she needs? Otherwise, we encourage male partner involvement in pregnancy and in labor. It's very, very crucial. Now, she also needs to know the means of transport that she's going to use. Is she going to use a boda? Is she going to use a hired cab like a taxi? Does she have private means of transport? Does she have a driver? Is she the driver herself? She needs to have all this prepared. And in case she's going to use a driver, she should have the contact phone, a telephone contact for this driver, so that at any time she can call upon this driver to come and pick her and take her to the health unit. Then the other aspects of birth preparedness or delivery preparedness include personal effects, items for personal use. This mother needs to prepare her clothes, okay, a number of clothes, because she will be changing them. And we prefer dresses that have a wide opening at the chest, okay, a wide neck or a wide opening at the chest. Why is this so? Because she will need to breastfeed, and this dress should allow her to access her breast and therefore be able to breastfeed her baby with ease. She should be having pads, okay, because she will be bleeding and will be changing pads. She should be having a number of underpants, okay. All these are personal effects. She should be having a basin, okay, should have a container where she will keep drinks. We usually encourage mothers to keep drinking during labor, sugary drinks for energy. Should be having containers for food. Should be having other toiletries like soap, okay. All these are things she has to prepare and pack in a bag, so that by the time she comes to the hospital, she is ready. She should also have prepared items for her baby, and these include the clothes for the baby, and these have to be warm, nice cotton woolen clothes, okay. The baby needs to have diapers. All these have to be there, and we usually have what we call a mama kit. This mama kit can be accessed freely through public health units, or it can be bought from drug shops and pharmacies. And this mama kit usually has some of the items that are used during delivery and also after delivery. So these are some of the things that every pregnant woman should prepare for. Another thing that a pregnant woman needs to understand is what we call danger signs, okay? These are some of the complications that occur during pregnancy, and some of them may not be predictable. They may occur suddenly, and some of them are life-threatening. Okay, those are what we call danger signs in pregnancy. There are also those danger signs during labor, and also danger signs even after delivery. We teach women all these signs when they are coming for antenatal visits, so that whenever such a danger sign occurs, she's able to tell that this is a danger sign, and therefore I need to run and see a healthcare worker. So right now we are going to talk about these danger signs. What are they? So for pregnant women, the danger signs during pregnancy include any form of bleeding. We don't allow or we don't take any form of bleeding as normal during pregnancy. We only expect bleeding to occur during delivery, and this has to be in moderate amounts. So whether it is in the first month of pregnancy or mid-pregnancy or late pregnancy, any form of bleeding is abnormal. It can signify some of the complications like antepartum hemorrhage, okay, where bleeding occurs from the placenta, or any other danger. So whenever a pregnant woman sees any bleeding, she needs to take it as a danger sign. Number 2, if a pregnant woman gets severe headache, or if she gets blurring of vision, her sight is not clear, if she sees alteration in her mental state, some women even reach the extent of getting seizures or convulsions. All these are abnormal and are danger signs in pregnancy. Excess body swelling. We know most women will have some degree of body swelling during pregnancy, mainly of the lower feet, lower limbs. But in case this bleeding is, this swelling is excessive, if this swelling involves the face, if this swelling is constant, does not go off, then it is a danger sign that she needs to report. Now, most women in pregnancy get on and off abdominal pains. That is fine. But any excessive abdominal pain is a danger sign that she needs to report. Now, women should start feeling their baby's movements at around 4.5 to 5 months. After that, if a woman cannot appreciate baby's movements, at least 10 movements in 24 hours, or she has reduced movements of the baby, that is a danger sign. It could be a sign that the baby is not doing well. The mothers we have usually gain weight during pregnancy, okay, and that is a good sign. It shows that the baby is gaining and the mother herself should gain weight. So if we don't see any weight gain during pregnancy, it is a danger sign. The abdomen should keep increasing in size as the baby grows, as the uterus grows. If we don't see this gain in size of the uterus, or the uterus gains size and reaches somewhere, gets constant, it is a danger sign that she needs to report. Now, the discharges. Most women will have some bit of discharge, which should be normal. But if this woman sees drainage of fluid, clear fluid, during pregnancy, it could be a sign that her membranes have ruptured and that fluid around the baby is the one leaking. That is also a danger sign that she has to report. So those are the danger signs that every pregnant woman should understand and be able to recognize and quickly report to the healthcare worker. There are those other danger signs that occur during labor. One of them is excessive bleeding. Moderate amounts of bleeding are okay during pregnancy, especially when the baby has been delivered. Yeah, that is during labor after the baby has been delivered. But if we have excessive bleeding of more than 500 mils, then that is a danger sign. Now, another danger sign is prolonged labor. We know once labor has started and is active labor, averagely women should deliver within 12 to 18 hours. If a mother labors for a longer duration than that, that is a danger sign that we have to attend to. There is what we call cord prolapse. That is where the baby's cord goes through before the baby has been delivered. That is also a danger sign. And excessive tiredness, excessive exhaustion of the mother is also a danger sign. Now, after the baby has been delivered, we also teach mothers about danger signs in the babies so that they can come back in case they recognize these danger signs. And these danger signs include a high-grade fever, okay, in the newborn. Another danger sign in the newborn is failure to breastfeed. If the baby refuses to breastfeed, that is a danger sign. Excessive crying, we know babies usually do cry, but if this is excessive, then that is a danger sign. If the baby has not passed stool after 72 hours of birth, that is also a danger sign. If the baby vomits all the feeds, it's a danger sign. If the baby develops yellowing of the skin and eyes, what we call jaundice, it's a danger sign. And if the baby develops convulsions or seizures, so these are some of the danger signs that we teach mothers so that they are able to recognize them and then quickly report to the health workers. So all these are part of the birth preparedness, because when mothers are aware of this, they will quickly respond and attention will be given in time. Now, there is another aspect of birth preparedness, what we call high-risk pregnancy. There are mothers who are at risk right away from the start. We know every pregnant woman is at risk of a particular complication, and some of these complications are unpredictable. They occur suddenly, and like I said, they are life-threatening. Sometimes they can lead to maternal death. So there are mothers that are classified as high-risk mothers right away from the start of their pregnancy. Then there are those who are classified as high risk later on during pregnancy. And this is also very important for every mother to know. Every mother should know whether they are high risk or not, so that they are given that close attention they need during pregnancy. So who are these high risk mothers? Number one, every mother or every pregnant woman who has had a long-term illness, what we call chronic medical conditions, including hypertension, diabetes, heart disease, lung disease like asthma, or kidney disease. If such a woman gets pregnant, these long-term illnesses may get worse. They may even affect the pregnancy itself. That's why we classify such a woman as a high-risk mother or a high-risk pregnant mother. Then women who are of extreme age, that is very young or very old. And by very young, we mean those who are younger than 18 years, and those who are older than 35 years are regarded as advanced age. Mothers in extremes of age face particular complications during pregnancy, and that's why we classify them as high risk. Then there are those that have delivered a number of times. We call those multiplers. Okay? Those who have delivered more than 4 times, more than 5 times. These are also at risk of particular complications, and we grade them as high risk. Now, those mothers who are carrying a multiple pregnancy, either twin pregnancy or triplet pregnancy or high order multiple pregnancies, all these are at risk of particular complications and therefore classified as high risk. Now, there are those mothers who have poor history. Okay, in the past they have what we call poor obstetric history, meaning their past pregnancies were associated with a complication. Either the mother had a complication or the baby had a complication. Those are called poor obstetric histories, and such mothers are high risk. We take care of them as precious mothers. Then there are those mothers that develop complications during the current pregnancy. For instance, those who develop high blood pressure, the one we call preeclampsia, those who start bleeding during the current pregnancy, what we call antepartum hemorrhage, those who develop premature labor during the current pregnancy, or who develop premature drainage of liquor or premature rupture of membranes. So these are acquired complications in the current pregnancy that classify them as high risk. And why do we need to classify these women as high risk? It's because they require closer attention, more rigorous attention, and their antenatal visits tend to be very, very frequent. And at certain stages of pregnancy, we admit these women so that they keep in close care of the health workers. However, one thing every pregnant woman must know is that every mother is at risk of a complication. Even those who are not at high risk from start can develop a sudden complication at any time during pregnancy or even during delivery. And you may find that complication was not predictable. And like I said, some of these complications are life-threatening. They require very quick attention. And if we don't attend to these mothers in time, they can die very fast. For instance, if a woman starts bleeding, they have only 2 hours to be saved from this catastrophic bleeding. So that's why we need every pregnant mother to be aware of these danger signs, be aware of these risks as part of their birth preparedness. Now, there are mothers who are supposed to receive specific medications during pregnancy or during delivery. For instance, there are those who have an abnormality with their blood group. We call it rhesus incompatibility. We usually give them a vaccine called anti-D at the time of birth or within 72 hours after birth. So those mothers should prepare early in time and should tell their caretakers that they need that vaccine. Sometimes it is bought and kept way before labor has started. Then there are those mothers who tend to bleed during delivery, and therefore we need to have booked blood for them and kept that blood so that we are able to transfuse them immediately after they have delivered or when they need. Then there are those mothers who have HIV, and we want to prevent exposure of their babies to HIV. We give these babies drugs, we call it nevirapine and other antiretroviral drugs to prevent the transmission of HIV from the mother to the baby. And the mothers have to keep on their ARVs, antiretroviral medication throughout pregnancy, and that itself reduces the risk of spread. So these are the special medications that have to be prepared during pregnancy and at the time of delivery. Now, as part of emergency preparedness plan, a mother should be aware if they are high risk or not, and therefore she should be able to know the level of health facility where she must deliver. If it is a high-risk mother, definitely she should deliver in a high-level healthcare setting where we have specialists, obstetricians, where we have services that can take care of these emergencies. For instance, where a cesarean section should be done, is there a theater or not? Are there doctors who are able to do this operation or not? If the baby is at risk, are there specialists who can take care of babies and services for those high-risk babies? So all this has to be discussed and understood by every pregnant mother. Okay? And once a mother understands this and is aware of this and is in constant discussion with her caretaker during antenatal visits, we usually have a good outcome. And by a good outcome, we mean a normal pregnancy, a safe delivery, a healthy mother, and a healthy baby as the outcome of the process of delivery. Thank you so much. And for more of this, we'll keep sharing with you with ATTV on our program of health and lifestyle. Keep tuning in and follow us on YouTube at 8TV and at NeoCare Clinic and Fertility Center. Thank you so much and have a good day.
You're watching 8TV, empowering you.